My name is Ali Ahmed, and today I'll be talking about disaster lessons for COVID-19. We'll highlight lessons learned, lessons observed, and lessons lost when it comes to applying previous disease information to COVID-19. I think it's important that we have a little background information on COVID-19. It's a highly infectious disease. It spreads from human to human. It's part of the coronavirus family. From Wuhan, China, origin unknown. It lasts from 2 to 14 days. You can be asymptomatic, and there's clinical trials going on for drugs and vaccine, and the first one in Dalhousie just started. Lessons learned that apply to COVID-19, and the first one is community engagement and building trust. So we know from Ebola and SARS that being transparent and building trust in the community can decrease infections of disease, and we have that in Canada, as you can see by Theresa May communicating with us. Learned is keeping essential health services open. So we know from Ebola and H1N1, closing of essential health services led to more deaths. So here in Canada, we learned by providing assessment centers just for COVID-19. It's providing safety for all. So we know from SARS that implementing social distance, wearing of masks, and closing public gathering led to a dramatic decrease in the amount of new cases. Two lessons observed, meaning that we see the same problems in each disaster or a new problem or issue arise. The first one is lack of hospital equipment, and this was seen across MERS, SARS, and Ebola. We've seen the shortage of ICU beds and lack of PPE, and this has been all across the world again. Second lesson observed is social media has mixed results. A lot of false information gets out there, which can lead to protests, as you can see the right in Ontario, and an increased stigma towards different communities. Lessons lost are things that we have not learned from previous diseases. A major one is stigma from HIV and Ebola. People have lost their life, isolation, ostracism, and now we see in COVID-19, the president calling it the China virus and how it is affecting the Asian community.
I would like to begin by announcing some important developments in our war against the Chinese virus.
Also slow political mobilization. So we know from SARS some countries were slow to act. And as you can see to the right, in Johns Hopkins University, we see countries in Asia were a lot quicker and had tighter restrictions compared to Western countries that had a lot more cases and deaths. Improve our emergency response for COVID-19 in Canada. Some of these are important to close the border, maintain social distancing, limit large gatherings, follow public health professionals, and decrease stigma towards Chinese community.